Okay, welcome along to the webinar. We've got a fantastic session today, all about how data has shaped the world's approach to COVID-19. It's a really exciting webinar and we are thrilled that you've joined us this morning, so thank you very much for your time. So this webinar is for educational purposes only. The views expressed by our panel do not represent the ESRC or university more widely. The Centre does not recommend any particular drug in the prevention or treatment of COVID-19, but this webinar will discuss the data that has shaped the world's response to COVID-19. You have heard the politicians' views, the virologists, the healthcare view. You may have even heard the economists' analysis of the pandemic. But now, for the first time, we're sharing data scientists' take on the pandemic that really has rocked the world as we unpack the data and take a look at the ways in which data has been used to help manage the outbreak. We look at the challenges and we explore what we can learn for the future. In case you haven't used Zoom before, you can put your chat in the chat bar that you can see just at the bottom of your screen. You can ask any questions. We will have a Q&A section at the end, and you can adjust your audio controls in the bottom right-hand corner as well. And we really hope you enjoy today's session. We are really proud to support organisations across the UK, and today has been brought to you by us, the Business and Local Government Data Research Centre. We are funded by the Economic and Social Research Council, who have been providing groundbreaking research for over 25 years, but there was always something missing, and that missing piece was data. As a result, they funded us as a centre. We combine fundamental research with applied for impact that influences policy and informs practices. We have three main priority areas. These include methodologies and techniques for data science and artificial intelligence, local economic growth, and vulnerable people. Through these three work streams, we support the research community, the public sector, and businesses alike. We have an international team of researchers, data analysts that are here to work with you. You can keep up to date on our latest publications and our work on our website, blgdataresearch.org, or join in the conversation online. You can find us on LinkedIn, YouTube, and Twitter. Please join in the debate online today on Twitter at BLG Data Research, and I'll be sure to look out for your tweets. There are many ways we can support you, and I just wanted to bring one of them to the forefront of your mind, which is the Data Analytics Innovation Vouchers. This is grant-funded support to work with our researchers to tackle a real-life challenge that you are faced with. And if you'd like to find out more about that, please contact me at the end of the webinar. Already working with us are organisations both small and large across the UK. They include organisations such as the police, the NHS, as well as smaller organisations, charities such as Fulham Good Neighbours and more. We would love to collaborate with you as well to help you use data more effectively. So to conclude, we support data analytics in all of its forms. This includes training, grant-funded data analytics projects, webinars such as this one, and they cover many other topics too, workshops, challenge labs, and we even offer a consultation service. So let's meet the team who we've got lined up today offering this fantastic panel debate. First off, we have Dr. Luke Abrams. Luke, would you like to take a few moments just to cover your research expertise?
Yeah, I'm Luke Abrams. My research is basically focused on using statistical models and machine learning prediction. I have two streams of research. The first, which is related to the centre, in which I work with our stakeholders on issues such as crime, health, and social wellbeing. My second area of research relates to my academic background in political science and political conflict, in which I explore topics such as dynamics of civil war, the impact that protests have on peace processes, and also I explore the effectiveness of United Nations peacekeeping. And I'm a senior research officer at the centre.
Thank you, Luke. Next up, we have Dr. Philip Wolnetsky. Philip, I don't know if you'd like to take a couple of moments just to discuss your areas of research.
Thank you, Laura. My work is in data science and also political science. So I work on forecasting, for instance, forecasting election outcomes, forecasting public opinions, questions such as support for gay marriage, and causal inference questions, so questions of cause and effect. One example could be, is there a relationship between poverty and COVID-19 mortality rate, and why? So what is the mechanism? So I work with machine learning as well and other quantitative methods.
Great, thank you very much. Next up, we have Dr. Kakia Shatsu.
Good morning, everybody. Thank you, Laura. My name is Kakia. I am a senior research officer at the ESRC Business and Local Government Data Research Centre. My research focuses on automated quantitative methods of processing large amounts of textual and other forms of unstructured data. Recently, I've been working with political text and social media. And also I'm interested in the methodology of text mining and text analysis. My substantive research interests also center around community resilience and the role of public policies and institutions at different levels of governance in shaping it. I've been recently also working on a corpus of COVID-19 press briefings data, trying to do work and analyze the text there. So thanks. It's lovely to have you all today this morning.
Thank you. And last but not least, we have Amir Jahovi.
Ladies and gentlemen, good morning. It's a pleasure to be here with all of you. I'm a senior research officer with the Institute of Analytics and Data Science and an honorary member of the Business and Local Government Centre. My research interests are machine learning, pushing the boundaries of AI with inverse reinforcement learning, and doing quantitative analysis. There's significant work that we can do together. Hopefully today we'll raise many issues that affect each and every one of us. So without further delay, I'd like to pass on to my esteemed colleague Laura, and I hope we have a wonderful session together. Thank you.
Thank you. So as you can see, we've got a fantastic lineup with us today. I can't think of any better specialists in data science to join us and really have this debate around the data of COVID-19. So first up, let's think about some key questions when it comes to COVID-19. So can you tell us some examples of where data has been used during the COVID-19 pandemic? Kakia, would you like to go first?
Yeah, sorry. So let me give you maybe the perspective of the natural language processing field, so where text as data has been used. And I can start with that and colleagues can fill in with other exciting examples. So there are loads of open data sets that have been created because of COVID-19. And the examples I have recently been really excited about are a lot of image X-ray data that have been made available by medical professionals that look after COVID-19 patients. So there has been quite a lot of work done there doing image recognition, recognizing or giving a percentage of certainty as to whether the patient might have contracted COVID-19 based on the X-rays. And I'd also like to sort of bring to your attention another interesting example where social media has been used to predict outbreaks. This is something that started back in 2016, I believe, when the previous SARS was the outbreak of the previous COVID version of that back in Asia. There it was used as an example, and this time round we had in the literature, we had scholars who also published information about a possible outbreak, because people were using more and more keywords such as I've got a cough, I've got a fever. So this is kind of soft data. It's not data where we know that COVID exists due to testing, but it's an interesting way of using data that's already out there, COVID-19, that to tell us that there is an outbreak. Finally, I'd like to sort of mention here machine learning used to mine through existing studies and citations on coronavirus. So one of the problems that scholars and doctors have when studying COVID-19 is the volume of information and the volume of data sets that exists out there from different scholars trying different things. So machine learning and text analysis can help bring that information, reduce that information to manageable volume, so that individuals and researchers can then look at the different information in a new perspective and carry on with the research without wasting time to read all of the papers and look at all the data sets. So maybe I can pass it on to Philip, who will tell you a little bit more about the data science perspective of it.
Sure, thank you, Kakia. So one of the examples that I read about recently, and I like quite a bit, is we know from previous research that poor housing conditions are linked to a greater risk of infection and also greater mortality rates. So if we were able to collect data on the quality of housing, and then use a machine learning algorithm to train that algorithm to predict for certain housing blocks in an area a level of risk, then that would help the authorities to provide help for caseworkers, also to provide information and just to have a general idea which areas are at risk of where the pandemic is likely to spread. And that's what people have done, researchers in Chelsea, Massachusetts. So that's in the United States. And yeah, I found that was a fantastic use of data. But also I would just like to add here that generally the amount of descriptive data that's available and that's being used by the public and by the media is astonishing. And it's I think it's something that is helpful and is hopefully going to continue. So let me pass it on to Luke. I think you wanted to add something.
Yes, thank you, Philip. So I think data and data analysis has been fundamental from the very start of the pandemic. So at the very beginning, we had very little information about the disease, how it spreads, and we were getting data from China at the time, but we wasn't really sure how it would affect the UK. And one of the most fundamental aspects of using data analytics was to try and forecast the impact that this would have on the UK. So there's a very famous model from Imperial College London that tried to forecast the number of cases that the UK would have and the number of deaths that we might have if we did nothing, if we had no kind of intervention in the pandemic. They basically estimated around 250,000 people potentially could have died. And they also highlighted the spread would occur very, very quickly. We could have hundreds of thousands of people that were very ill, needing hospital support. And, you know, it's well known that there was the fear of overrunning our healthcare service, which I think would occur in any country really. So trying to understand when there's not a lot of information in the beginning, what the impact might have been was fundamental. And that kind of forecasting really aided policy and led to the lockdown. And they estimated that there would be between 20 and 30,000 deaths if we had a lockdown. It's higher than that, but still, you know, it helped to inform policy at the time. The other kind of element is that data analysis has been fundamental in trying to find a cure and also effective treatment. Again, at the beginning, apart from trying to place very ill people on ventilators, there's not really any proven treatment against the disease because, I mean, even now it's still very new. But there's been various studies to try and look and explore what drugs might reduce the likelihood of death. I mean, recently a study found in the UK that a very well-known steroid that's cheap and widely available actually helps to reduce the number of deaths once someone is in hospital. So when needing oxygen support, reduces the number of deaths from 25% to 20%. And once you're in the ICU unit and you're on a ventilator, it reduces the percentage of deaths from 40% to 28%. So this is really crucial. And, you know, potential spikes in the virus or a potential second wave anywhere in the world, this will really help to save lives. So yeah, I just wanted to make the point that data and data analysis have been absolutely crucial from the beginning. And I'll pass on to Amir.
Thank you very much. Well, data science has been used in many, many ways. And the most obvious is modeling the behavior of the virus. You've all heard of the curve and flattening the curve. This is basically modeling the behavior and how it will interact with the population. But beyond that, there's much activity that has been done by companies, organizations, and many governments. The most notable is joining different data sets together in a rather unique way that hasn't happened ever before. So you might imagine that there are many ethical and legal restrictions in accessing and using data, and significant work has been done on removing these barriers and sharing information, whereas they previously were in individual separate silos. Now they're available to analysts, for example, to identify individuals that are vulnerable and in need of special assistance and care. Another area that data is being used currently is to identify a vaccine or basically a combination of treatments that will prevent the spread of the disease. And this is done in a computational approach rather than a traditional laboratory manner. And this is a leap in medicine in developing cures. So the old traditional ways are not fast enough, not efficient enough, while with correct application of data science and computational techniques, predictive modeling, it may be possible to identify candidates that will be more suitable for laboratory tests rather than just searching in the dark and testing everything one by one. So these are some of the examples that come to mind currently.
I wonder if anyone wanted to speak briefly about the tracking apps and the data that's being collected there, kind of combining geographical data, behavior data, as well as maybe even success data to see if that really is a model that we can use moving forward.
If I may continue on this, it's one of those things that I believe the best way it will work is going to be with individuals volunteering to participate, being aware of the potential benefits, because as you may imagine, there's going to be many debates on the legality and the ethics of tracking the movements of every person, every individual, where they go, who they're in contact with. So we need to collectively come together and agree on what the boundaries are, what the limits are of this kind of application of tracking, live tracking. And once trust is established, people will be able to sign into these services. And again, with many illnesses, it would be better to prevent than to cure. So they will very possibly be able to get notifications of, okay, such and such person that is in regular or frequent contact with you is at risk, so protect yourself or avoid certain contacts or certain routes.
Excellent point, Amir. And as well as for the prevention rather than the cure, I completely agree. And I think there's a lot of data emerging at the moment around risk factors, complication factors, and also causes of why these pandemics are even occurring in the first place, which hopefully we can implement in the future. Okay, let's move nicely on to our next question. As data scientists, what are the challenges you feel of using COVID-19 data? Luke, I don't know if you wanted to go first on this one.
Yeah, sure. I think the first challenge has been it's been kind of data collection in the first place. So it's understandable that a lot of collection efforts have been kind of reactive rather than proactive, because it's a very fast moving scenario, and the pandemic has happened very quickly. There has been discrepancies in how data is collected. I mean, even in the UK, let alone across different countries. So, for example, the official figures for a long time in the UK were based on COVID deaths in hospitals, which clearly underreports the number of deaths that are actually occurring across the country and also in the community. The Office for National Statistics was taking a different approach, in which they were looking at death certificates to see whether COVID is mentioned. So they placed the figure much higher. So official figures are around 45,000 or just under at the moment, based on people that have tested positive for the virus. Whereas the ONS put this higher at around 52, 53,000, based on death certificates. But there are concerns that this may actually be some level of over-reporting, because some of these patients are not tested. And the assumption is that they may have had the disease because they fit the kind of description. But as we know, there's various other viruses that also overlap with the symptoms of COVID-19. And then there's a third measure of excess deaths, which is even higher, which is around 65,000, which is essentially over the last 5 years, there's been 65,000 more deaths than there would normally be. But again, we're still not sure what that means. Is that all COVID related, or is it indirectly related to COVID, in which we've diverted resources in hospitals to fight the pandemic? It's still not really sure. So there's 3 different measures there just for COVID-19 deaths in the UK, and this is problematic for analysis, really, because there could be measurement errors. There could be overestimates, underestimates. And then comparing this with other countries is challenging because, for example, France very early on included deaths in care homes in their official statistics, whereas that occurred a lot later in the UK. You have other countries that are not reporting statistics. For example, Tanzania has stopped reporting in the last month. And also some countries just don't have the capacity to do testing. So a lot of this is going underreported. So we know in areas of Somalia, there's been a lot of excess deaths, but very low levels of COVID-19 have been reported. And then other countries like the US and Russia, and Germany have very high capacity to test for COVID-19. So it could be that they're picking up more than elsewhere. So it's very difficult to compare not impossible, but it's very difficult to compare some of these figures, and we have to be mindful of that, essentially. I also wanted to touch on, and I know Amir has a few things to say about this as well, is data silos. So we have issues where there's data being collected in different places, and this is not always being shared. So a good example was Public Health England, which were collecting, again, going back to data collected by Public Health England, the data collected by the Office of National Statistics. These weren't combined. So you had hospital deaths on one hand, and then you had community deaths on the other hand, and this wasn't combined until quite late on. So there's an example of a data silo. A second is the continued testing that we're doing now. So we have pillar 1 testing, which is still testing in hospitals, which is conducted by hospitals. And then we have community testing, which is pillar 2. And this is done by commercial organizations. It's only recently that they've combined their data. So recently with the outbreak in Leicester, you had an issue where local health providers and trusts were not aware of how much virus was occurring out in the community because it was being collected by a different entity. So we have to be, very careful and try to fix these data silos and share more data essentially. And I'll pass on to Amir.
Thank you. The first thing that comes into my mind is really we're being challenged as a species, as a civilization. It's not like the world of economics and money where a whole nation can go down crashing and burning and it's business as usual across the globe. If a virus that passes from human to human occurs anywhere, it's going to be on our doorstep in a few weeks. We see it. So really we have to move past the reaction and sort of passive combat. Think of this in a more intelligent way. At the current state, we really haven't been prepared for ways of dealing with a pandemic, with a disease that spreads so rapidly. So this is not going to be a high-tech problem. It's really consensus of how technology should be used in a more intelligent way, tracking the progress. Again, my esteemed colleague Luke mentioned that there's been so much error in reporting rates of infection, number of infected people. At the initial stages, even the World Health Organization wasn't quite sure if it passes from person to person. Looking back, we see that there's ample evidence of it. There was ample evidence of it at that stage. So I think really there should be some, again, at global level, some consensus agreement on how we should do this correctly, ethically, because obviously there's great potential for misuse and abuse of this type of sort of activity. And the activity that I'm speaking of is basically tracking, sharing information. It could lead down to dark paths, so to speak, but if it's done correctly, it could save us, because this is not going to be the last time we face this kind of a problem. Again, there's a high probability of secondary, maybe tertiary rises in the infection numbers. So the sooner that this happens is better. How to apply tracking, individual tracking, ethically and legally, and how data is shared between all governments, all local authorities worldwide effectively. Because if the numbers going in is rubbish, what comes out as a result of the analysis is going to be rubbish. So we've suffered greatly as a result of that. Now imagine if this was properly tracked, identified, analyzed in the early stages, it probably wouldn't have come to this. So there's a lot of work and discussion that has to be done by all of us. It's just our first priority, really. So hopefully this is what's going to come out of it.
It's 11 o'clock.
Do you think that the data scientist perspective and the researcher perspective are involved enough in those discussions at the right levels to really influence what's going on in terms of recommendations? Because obviously some of the challenge comes down to the virus itself and the terrible effects that has on people, but a lot of the impact, the negative impact that people are feeling, has been as a result of the lockdown itself and the isolation, the panic buying, and the not being able to predict the demands that people have, and the impact really that being socially isolated can have on the economy and people's mental health. I just wonder if there is a wider debate to be had and if data scientists aren't involved in that.
it's not a matter of knowledge, it's not a matter of technology. The panic was just natural human reaction to lack of information. Something like that is happening. Your first instinct is to protect yourself and your loved ones. That's completely predictable. While if there was sufficient information in the beginning, and this is not blaming anybody, this is the first time such a thing has ever occurred. But now that we know how this kind of thing happens, it's really the governments, political bodies getting together and agreeing on how this should be handled ethically, humanely, and also scientifically. So those numbers, those pieces of information that would have helped the panic never take place in the first place. They weren't available, neither to the general public, nor to people that make decisions and basically govern. So it's a task that has to be undertaken very seriously from this point onwards. There's nobody's fault. It's the first time we're facing something like this.
Good point. Philip, did you have any points on the challenges that we've been facing using COVID-19 data, whether that's related to the virus itself, the lockdown, or any other area that you feel would be applicable?
Yes, sure. Thank you. So I think I'll pick up on what you mentioned, Laura, and what Luke was also talking about biases and measurement error. For instance, with excess mortality. So these things, so for instance, right, if we take excess mortality as a measure to compare countries, then we don't really know whether some of the excess mortality is caused by the lockdown, or whether the lockdown alleviates excess mortality. We don't really know what goes into that measure, but it is relatively comparable. So that's a good thing. But with all of these measures, we're going to have some biases in them. And it's good to be skeptical of that, and to be mindful of it, and to think about it and know it. But it also doesn't mean that we can't use these measures. So for instance, if I'm measuring, if I'm trying to measure new infections, and my measure is somewhat incorrect, as long as it still correlates with what I'm trying to measure, I can use that as a tool for prediction. I can see general trends, I can see correlations, and that's really important for making predictions, timely predictions, and then also for carrying out research later. So I think my takeaway is that yes, we have a long way to go in terms of improving data quality, but we have a lot available, and we can use it.
Do you think that it's about the quality that's the main issue that has resulted in many countries across the world analysing the same data, but coming up with completely different recommendations or different conclusions as a result of analysing the same data set? I'd be really interested in your expert take on that one.
I think that's a general problem with data science. I think that, or indeed with any science, I think that you have to, at the end of an analysis, you have to do some interpretation. And it's possible to come to different conclusions that then need to be argued in some way. And there's usually in the scientific process, there's a discussion about that called peer review, where experts discuss reasoning, and then if some work is published, then there may be another article that's published afterwards that criticizes that approach. So we always will have different interpretations and different takes on what we learn from the data. So that's something to be expected.
I agree. It's a complete...
Actually, that's also something, sorry that I interrupted you there. I think that's also something that's positive in a way, because it's through the back and forth and through the criticizing, we are, I think, coming closer to good answers.
It's about using the collective knowledge of the whole world, the whole research community, and continually learning throughout this process. Really good points. So what can we do differently in the future when collecting and using data during this pandemic or during a future pandemic? What can we really learn? I'm not sure who wants to kick off this round. Luke?
I can start.
Yeah, if others don't mind. Yeah, I think the future really, I mean, we've already been kind of already been speaking about that really. Essentially, the future is, you know, more data. The more data we have, the more kind of answers we can provide. And, you know, and also we've been speaking more about the quality of data. But I think there's a lot of potential moving forward. So, especially in terms of testing. So there are other pillars of testing in the UK strategy, and the third pillar is antibody testing. So one of the challenges with this disease is there's a high number of asymptomatic people. And, you know, data is one of the ways that we can see the disease and see where it is. But it's very difficult with asymptomatic people, and a lot of the testing that we're still doing is focused on people that have symptoms. So we still don't know how many people have had the virus, potentially, how many people are asymptomatic. And you can see how, you know, these are fundamentally important. So, you know, looking at future modeling, there are assumptions that are made about the number of people that are asymptomatic, the number of people that could potentially get the virus. So we feed these assumptions into our modeling. So this will inform better modeling in the future, but it also gives us better data and a better understanding. So, you know, for epidemiologists trying to understand how the disease spreads, one of the last large remaining questions is, you know, how many people are asymptomatic? You know, how is this spreading? Which is going to be fundamental in understanding this in the future. The second relates to that is the fourth pillar, which is, you know, more random testing. So as I said, we're focusing on testing people that are asymptomatic, and we could only be picking up, you know, the tip of the iceberg. So more random testing, I think, is crucial, and this is already being conducted in hotspots, so places like Leicester, where they're trying to pick up the disease and trying to pick up and understand more how it's spreading, what the actual rate is, and this all informs our understanding of where the data is, where the disease is, how it spreads, you know, and we're going to need this moving forward when future outbreaks occur. Yeah, I will stop there. Pass on to whoever else wants to go next. Kakia, perhaps?
I can go next. So in terms of natural language processing, there were two sort of challenges when trying to. So there was a large use of apps that were issued or were distributed by big companies like Apple and Google, trying to tell us or walk us through our symptoms. So there are opportunities there in terms of the use of chatbots, so virtual assistants, where you would be able to describe your symptoms and them sort of helping you determine possible disease that you might have. So this is a big kind of field in healthcare data and healthcare natural language processing. So there is a lot of opportunities there in terms of personalizing people's experience, but also in terms, there's quite a lot of challenges in terms of the ethics around the data that's collected, who stores it, how it gets mined, and so on and so forth. And the other opportunity that, again, sort of links a lot with the work that researchers are doing are around openness. And by that, I mean the availability of information for everybody to download, work through, replicate, and so on and so forth. Of course, there were aspects of it in a lot of topics, but when it came to COVID-19, we saw a lot of effort from academic publishers and researchers working on COVID-19, not necessarily when it comes to the medical aspects and the kind of finding a vaccine for it, but also the social aspects of it, to share information with other people, to make their work available online. And I think, and I get a feeling, has created a kind of a step for everybody to make their information and their work available online. This has created new opportunities for collaboration, not necessarily among researchers, but also between researchers and the public. And there's quite a lot of these papers, this academic expertise that is available for everybody to download and view, read, and experiment with. There's also been, again, thinking about how medical data is shared. There's been an unprecedented kind of understanding of the need for medical data and other data around a patient's journey to be shared and to be given to medical professionals in a way that's digestible and can follow through that patient's journey. So again, in terms of how before it was perceived as very siloed, now I think there's an opportunity to make that important. And I'll hand over to Philip. But I'm happy to answer more in the Q&A session around that. So I'll hand over to Philip to tell us more about it.
Thank you, Katia. Thank you for those are all really good points. So what I think I would only add that I'm really a fan of the the Corona Warn app approaches. I think just to summarize, maybe if not everyone knows how it works roughly. So someone who has the app on the telephone then has an anonymous ID, and those IDs are exchanged via Bluetooth, and they record time and proximity of IDs, of different people. And so if I test positive, I can then notify all people anonymously to get tested. And those people can get tested immediately at the nearest test center if they show the notification from that app. So I think that approach has the potential to speed up the detection process by quite a bit. And there are some estimates that 60% of cover, so 60% of the people using that app could significantly slow down the spread of corona or even stop it. So I think that's something that's extremely promising, and there will be trust issues with this kind of app, and that's something that Amir has touched on before, and I think that's something that we need to work on. So communicating, building trust for these kinds of approaches, because I think we can never use data and guarantee complete anonymity to all people. So there's going to be some sort of trade-off, and that's something that needs to be addressed and discussed. Okay, so I think I'll hand over to Amir.
Thank you so much. Well, this is the challenge of our generation. It's our World War II. And really, although there are no bullets and bombs flying around, the damage is very real. So what we can learn, and I believe that much of it is already in the process, is basically hardening our infrastructure. The analogy would be civil defense, passive defense. How to make sure that there's no shortage of food and medication, that as a result of the pandemic and other problems, heart problems, cancer, different injuries, these are not being pushed to the side, how these are going to be managed correctly. And again, I'm saying this knowing that there's much great work being done right now as we speak, not leaving it for the distant future, but being prepared for this in the near future, next few weeks even. And also changing our way of hygiene, general cleanliness. This is going to be effective in stopping the transmission of any disease in the future. currently we're, as a people, as a civilization, we're really not sparing any money or expertise on developing cures. We're really at the end of our reach. And again, a new disease comes and all this has to be repeated. So I think that kind of passive defense is going to be most important. What we can learn from this in the future, after hopefully very soon this is all over, is recovery policies. Because there's been immense damage to the economy and many people are going to face challenges with employment. So the whole way of doing business and creating and selling, this is going to change drastically. The way countries recovered after the Second World War was drastically different to the way things happened before that event. And I think the same thing is what we're going to be facing. So there are opportunities to learn from the damage that's being done. And again, I think it's important here on behalf of all of us, if anybody's lost somebody due to COVID, you have my sincere condolences. We're all one in this. And finally, just to not to go on for too long, there's going to be the opportunity of using machine learning and data science in identifying factors that make a certain portion of the population immune, and then searching and finding what those factors, those patterns, or so to speak, those features are that make these individuals immune, and then how to find medication that could also create that immunity in the rest of the general population. There are many avenues, and all in all, I feel very optimistic towards the future. We're doing the best we can, and hopefully this is a lesson that we won't have to take again. We'll learn all we have to. So that's all I have to say. Thank you.
Wonderful, thanks everyone. We're going to have to move, Luke. Yep.
I just quickly wanted to say as well, there's also a huge opportunity to use data to try and assess the impact on society, because we have focused on COVID, as Laura's already mentioned. There's issues with mental health. There's other issues as well where resources have been diverted away from, for example, cancer treatment. There's all sorts of vulnerabilities in society that we need to understand, so that if we do go into a lockdown in the future, which is a possibility, we need to understand how that impacts people better, and also the long-term effects of what this is going to happen on education. Children have lost out on months of schooling. And also, there's so many different social aspects that we need to explore, using data science, and it provides evidence for policy, essentially. I'll just leave it there.
That's really good points. I'm just rushing us on because I want to have plenty of time for everyone to ask their questions at the end of this really fascinating debate. So thanks everyone for joining us. Okay, this is just one of many webinars that we've got coming up, and I just wanted to bring a few of them to your attention before we hand it over for your Q&As. So we've got Bounce Back from COVID-19, a GDPR virtual masterclass coming up in a couple of weeks' time. We've got everything from data strategy to data audit, really improving your way, the way that your organization uses data more effectively. But that's not all. We're back in October for using open source data and the value that it provides to you, your organization, and wider society. And then moving on right through to November and even January 2021 on social return on investment. If you'd like to register for any of our webinars, you can find them all online at BLG Data Research, where you can find the whole list right at the bottom of the page, and some nice information about each of them, including the link. As ever, these are all free opportunities for you to learn from our experts. So let's open it over to you. After our debate today, what questions do you have? You can type them in the Q&A bar now. And so I'm just going to have a look through to see what questions we've got. What are your thoughts on the potential level of misattribution of deaths of COVID-19? Have you had to factor this into the work on COVID data? And how have you or would you approach this? A fantastic question coming in from Sam there. I don't know who wants to take that. Luke, I think it resonates, or Philip, slightly with what you were talking about earlier.
Yeah. So I think it's definitely a problem, and it's something that can be a bigger or a smaller problem depending on the type of question that we ask. So for instance, if we are looking at over time developments, I think I would see it as less of a problem than if we compare across units, across countries, for example, because then the different handling in different countries might bias more or less. There are ways in which we can deal with such bias. So there are a type of models that are called selection models. Selection models require that we have some assumptions about what causes the bias or which way the bias goes. So if we're completely unsure of which way the bias goes, then we really have no way of dealing with it. But there is going to be research on this, and there's research on bias generally. So for instance, I'm doing research in bias on voting records of legislators. So these kinds of problems are problems that are ever present in data, and that we're going to see more knowledge come out or be produced in the future. But really at this point, I think we don't really know.
Luke, yeah?
Yeah, I just wanted to echo some of that really. So I think this is not unique to COVID-19 data. This is, you know, with all data sources that we used in various different projects. There's always these issues that, I mean, as long as you're aware of it, and as Philip says, there's ways to counter these problems. That I think that's important, but often it's a trade-off. So I mentioned about the ONS statistics, and perhaps it is, you know, inflating the number of deaths. So if any, you know, I don't really understand, you know, at the coroner level, you know, how this works, but, you know, it seems to be if there's any kind of respiratory issues, it's being placed under as COVID-19. So there could be error here, but, you know, comparing across countries is about a trade-off. So, you know, I mentioned about the lack of, you know, underreporting because some countries don't have the capacity. So, you know, if I was looking at countries, perhaps excess deaths is probably a better measure to compare across countries. But then again, we still don't know, you know, what them excess deaths equate to. So is that the virus, or is that everything else that's happening because of the virus, or both? So yeah, essentially it's a trade-off.
Great.
Yeah, leave it.
Great point. So we've got another fantastic question. Please keep these coming in the question and answer boxes. Given the interpretation is so key to political and personal decision making, what can we learn from Kakia's text analysis work? How have text trends and our responses to them influenced the impact of COVID-19? Over to you, Kakia.
So thanks very much for this really good question, Sam. It's a really big question as well, so I'll try to very quickly address a few points, and then by all means get in touch with us for more. So what I would say from my point of view and from what my research is showing, the way we talk about something, the way we write about something does influence the way other people react to it, for sure. And there has been quite a lot of other work about other topics. So fake news, misinformation, and propaganda is a very big sort of literature that speaks to that, about how wrong and conspiracy theories and all that, how could something that's not necessarily factual excite people's imagination and could be spread in a very similar way as a virus spreads in that point, from that point of view. We do have responsibility as individuals in the same way as spreading, as sort of stopping the spread of the virus when it comes to misinformation, but also it takes, it's also kind of the duty of the state and all states general, so international organizations like WHO, to stamp this misinformation out and make sure that the correct information gets passed on by informing people, by building a culture of trust, and so on and so forth. And of course, social media and the way the misinformation spreads is a really big area of interest that can tell us something about why, for example, some people in some countries protect themselves using masks, and why in some of other contexts that's not a good thing, or that's not perceived in the same way when, for example, the factual evidence is one and the same. So I'll stop there, but happy to follow up further with you offline if you prefer.
Really good point, thanks again. So another brilliant question, the desire and readiness of academics to be open with their data and findings is interesting, and a challenge to publishers who want to monetize and control academic output. Do you see this leading to greater long-term openness? Amir, yes, please, go ahead.
Yes, I think this is going to be an interesting output of this whole situation, because through patenting intellectual property, the benefit is that the creative work and the output of somebody's efforts is protected from theft and from misuse. The flip side is that people end up reinventing the wheel over and over and over and over. So the balance when it comes to public health and safety, there should be a line drawn in the sand that, okay, this is something that is crucial to the well-being of the population, of humanity in general. But this is the story with so many technologies, techniques, methods, intellectual novelties that are just stored away. If such a thing happens, we'll be living in a very different world. So hopefully, yes. Hopefully when it comes to public safety and health, technologies, inventions, methods, from a certain point onwards, we don't want to empty anybody's vault either, but hopefully in the future, there's going to be some sort of change in policy that when something can potentially save millions of lives, it shouldn't be restricted.
We've got a fantastic point in here as well. Is there potential for big data and analytics to determine the optimum balance of easing the lockdown for the economy and general public mental well-being versus public health and safety? Yes, Luke, please go ahead.
I think it can play an important role, but it's one tool of many tools that would have to inform that. So, with better data, we can do better analysis on all these different aspects and try and, find that better balance. But essentially, it's going to be a combination. Data analysis is just one tool amongst many. There are many kind of like health experts, social experts, experts in the civil service that know various areas very well. It's a combination of all these different kind of efforts, but essentially data analysis is one tool that can be super useful.
Great point. We've got another really, really good question, so please keep these coming in. Do you have any thoughts on the impact of BAME, especially given the definition of BAME? The context is different in different locations, basically. So from a global perspective of the pandemic, so Blacks and Asians are not minority populations at risk in different countries. So the question is fantastic. It's quite a long one, but it's around the data around BAME and the risk, and how there isn't a consistent definition globally. Luke, please go ahead.
I think, I mean, this is fundamentally important because we're seeing across the world that minorities in various different countries are more at risk of the virus or more at risk of dying. So, you know, looking at the descriptive statistics, there is a clear distinction here. You know, if you're from certain backgrounds, there's a much proportional percentage of people from that background dying compared to the majority within a country. So depending on how you define it, I think the key question is what's going on here. So the problem with descriptive statistics is it's saying that there's something here, but it's not telling us why. So a really important question moving forward in various different countries is, why is this occurring? Is this because of occupation? You know, certain people's occupation? Is this because of deprivation? Is this because of households, you know, having more people in a household compared to others? You know, there's various different factors. Or is this because the disease disproportionately affects people from certain backgrounds? I mean, in like a medical way. So there's plenty of research to be done there. But you know, there is something going on across the world where there are certain minorities that are more vulnerable to the virus, but we do not know why. But we need to find out.
Katia, did you want to make a point?
Just a quick one in terms, again, I mean, it brings us back to the issues that we raised in the discussion about data collection challenges. When you collect data, you need to define what it is that you're collecting, and if possible, keep it the same throughout the duration that you're collecting it. If you're changing it, make a record of how it changes so that you know how to adjust it in your analysis. And it also gives us a very kind of interesting opportunity for standardization when it comes to collecting data around epidemics. So epidemics or pandemics are events that happen around the world. We need to make sure that when we collect data around them, these are done in a consistent manner through a standard way across the whole world. And it sort of highlights the importance of having organizations that look after the quality of data, like the UK Statistics Authority we have here in the UK and the Office for National Statistics, and also around the world. So WHO, they also have an Office for Research and Innovation that is supposed to look after how this data is collected around the world. So whether they do a good job or not, that's not for me to say. So just a small point there.
Really good point, thank you. So another question's come in: will the recording and slides be emailed to all attendees? So they will not be emailed to all attendees. They will be on our YouTube channel probably next week. So please subscribe to our YouTube channel so you can listen again. Really good question though, thanks, keep them coming. We've got a great question here. Re the excess death stats. This attendee today would be very interested to know the offset for regular deaths, such as traffic accidents, that wouldn't have been at a much lower rate during the height of the lockdown. She doesn't really heard about very often. That's a really good point. So while we've seen negative effects of the lockdown, there have probably been positive effects in terms of death rates. So Luke, yes, do you want to take this one?
Sorry, I just answered in the chat as well to that question. So I think this is really interesting. So I mentioned about excess deaths, but one thing that has been occurring is, there's, during the lockdown, there's less people on the roads. People are more hygienic than ever before. So there could be, normal deaths that will occur for certain factors, such as flu or other factors or road traffic incidents, that could actually be lower. Which would bring the rates below that kind of average rate. So there could be more COVID deaths than we're aware of, or there could be consequences of COVID, deaths that are related to the consequences of COVID. There could be more of that. Right now we're actually below that average. Now the COVID deaths have come down. We're actually below the average of normal deaths that we know a year. But we just don't know. So this is something we really do need to find out. There is some deaths that have increased because of COVID. COVID has obviously increased, led to a lot of deaths, but there's also some aspects where deaths have reduced. But again, we don't know because it's all kind of lumped together at the moment.
Really good points, thanks. Philip, yes, last point.
Thanks. Just to add to that, I think with excess mortality or excess death, it's really about why are we using it, right? So for instance, we could be using it to compare countries. I think that's where the strength really in that measure lies. And then it may not be that important, right? Or it may even be a really, really good measure because it includes the effects of the lockdown and the effects on psychological well-being and so on and so forth. So because it's so holistic, it may be really good to compare policy approaches of countries and to see what we can learn from that. So there definitely are some biases in that measure. It doesn't only capture COVID deaths, but that may actually be a strength in some applications.
Absolutely, great points. Thanks, everybody. So that really concludes today's webinar. I really want to thank everybody for joining us. Don't forget to join in the conversation online on Twitter at BLG Data Research. You can find us on LinkedIn and obviously on YouTube too, where you'll be able to listen again to this webinar, as well as many others that we've done so far. Thank you to all of our panelists today, our fantastic senior research officers who work for the Business and Local Government Data Research Centre. And thank you to all of you for joining us and taking some time out of your day. It's been a pleasure talking to you all, and thank you for the fantastic questions. Keep them coming, join in the conversation online, and email your thoughts over to us at BLG Data Research or tweet us at BLG Data Research, and we'll be sure to get back to you. So thanks again, everybody, and enjoy your afternoons.
And thank you to you, Laura, for a great sharing. Thanks very much.
My pleasure. Take care, everyone. Bye.